What can I do about painful penetrative sex? This is asked by a woman. Hi, my name is Martha. I'm a clinical sexologist with a doctorate in human sexuality, and I'm from Eros Coaching. It's been reported that 1 in 4 women has experienced some form of pain when it comes to penetrative sex. And I'm making reference to heterosexual relationships. What happens a lot is that the man is having some kind of performance anxiety with regards to his penis. He's afraid that he will lose his erection if the foreplay goes on for too long. So they don't really have enough sexual confidence to be comfortable with prolonged foreplay. As a result, they're actually attempting or having penetration a lot sooner than a woman would like. And when the woman is not sufficiently aroused, she'll have pain during sex. And this foreplay that most women need is actually about 15 to 30 minutes. A lot of people are not comfortable with their hands and with prolonged foreplay, not just because of their confidence with their erection, but also in terms of touch. They don't really know what to do with themselves, and their partners have said, don't do this, don't touch here, don't do that. And then they want to do it, but they don't know what else to do. So the lack of sexual communication and the lack of sex education actually causes some of these problems, leading to painful sex, which actually in turn leads to lack of sexual desire. Because if you keep having pain, you don't really feel like having sex. You start avoiding sex, and then it becomes a much bigger problem on the long run. What can be done when it comes to painful sex, a lot of sexologists would say, is to use lubricant. And I want to say that lubricants can help and lubricants are useful, but lubricants are not going to be and shouldn't be a replacement of your sexual arousal. I know that there are women who have the lack of vaginal secretion, which means they don't really get very wet. No matter how aroused they are, they don't get very wet. This is not the same as putting on a lot of lubricant when you're not aroused. It seems the same, but actually it's not the same. I want to be very clear about that. When we are sexually aroused, our genitals, I'm talking about females, will actually grow to 2 times its size. Everything internally will start to swell up and fill up with blood. And this whole area is warm and it's mushy, and it's a form of like a cushion, that allows the penis to come in without much pain. Just as the penis grows to 2 times its size, we also grow to 2 times our size. And so what happens is, just by putting a lot of lubricant, it still doesn't necessarily help with the pain. So that's why I'm emphasizing on the importance of sexual arousal and sexual communication and sex education. The importance of communication and trying different things is very important. Some people just get stuck in pattern, and then they don't really know how to tell their partner that they've been having pain. So these are some of the things that I have that are very common. The next thing is, some people don't really know how to experiment with the angle of penetration. Sometimes the penis is just entering at an awkward angle, and that is maybe pressing on certain parts internally that is causing some discomfort. Some pain is not necessarily bad. I mean to say that it is so common to have pain. Everybody is saying pain, pain, pain. But I need to ask, as a sexologist, more precise questions to start understanding what exactly they're talking about. And so there is this misconception that any pain is bad. Sometimes the pain is because of the angle. So all you need to do is shift your angle, and then the pain, voila, is gone. And so it's really important to start checking into yourself. Where is the pain? Is it at the entrance of the vagina? Is it deeper inside? Is it because it's hitting my cervix? Is it because there is some tearing? Is it because I'm not wet enough? Is it because I'm not aroused? So start exploring these. Some people just have no idea, and it's very important to maybe start keeping a little journal. So you start documenting your experiences, you have a better idea of what your body is going through. And then you are able to get better answers when you seek out expert advice. You might even want to map out the pain levels that you're experiencing and how often and in what position. All these details really helps these experts that you go to give better suggestions. And my work is a lot like a detective. I'm trying to get a sense from what they're saying and then piece little clues together to then give them specific solutions that will help them in their situation. So there are a lot more things that I can talk about, but I think it's pretty I've covered a few things here, and I think we can call it a wrap. So just to summarize, we talked about the use of lubricants. I'm not saying don't use it. I'm saying don't substitute it with arousal. I'm talking about the importance of arousal and communication, and for the person with the penis to explore what you can do in order to have better sexual confidence. I have a program called Ready, Get, Sex, Go. And also maybe for the person experiencing pain to see if adjusting the angle might help with the pain. And sometimes, voila, no pain. I'm serious about that. And another thing is to perhaps see if you can keep track of what it is that you're experiencing. And sometimes by paying attention to your own body, you start getting these answers for yourself just by noticing whether it's this or that, or maybe sometimes it has to do with the fact that your period is coming, and so at certain times of the month you're more sensitive. And it doesn't mean that you have to stop having sex. It means that you probably just need to be more aware of what can work for you better during those times, because our body does go through a lot of changes at different times of the month as women. Okay, so this has been Dr. Martha Tarali of Eros Coaching. If you have a question, please drop me an email, and you can email me and ask@eroscoaching.com.